if you're about to turn 65 and getting ready to get on Medicare, this video is for you. My name is Malia Rogers from Medigap Pros, and I'd like to go over the basics of Medicare with you. So you have different parts of Medicare. You have Part A, B, C, and D. A and B is part of Original Medicare, and Part A will cover your hospital and skilled nursing facility expenses. So Medicare Part B will cover 80% of all your medical expenses. And 20% doesn't sound scary. However, there's no cap to the 20%. And so it could be financially devastating if you had to come up with 20% if you had a major medical issue such as cancer or heart attack or stroke. And so we're going to talk about how you can cover those gaps. There's two routes that you can take to covering that large 20% gap. You could either go with Original Medicare and add a supplement and a drug plan, or you can go with Part C, which is an Advantage plan. Now there's pros and cons to doing each route, which I'm going to go over with you, but the main thing is everybody's different. So it's going to be dependent on your current health, your needs, your budget, your risk tolerance, and where you live, because different options and prices vary depending on your location of where you live. In general, if you stick with Original Medicare, add a supplement and a drug plan, then it's going to probably be most likely the more expensive per month route. But the reason why people love this route is because, number one, you can choose any doctor in the nation that takes Medicare. For some people, this is really important because if you have a major critical illness, you can actually seek treatment anywhere in the nation that takes Medicare. So if you had cancer and you wanted to fly to Texas to go to the best cancer center, or you want to go to the university hospital or Mayo Clinic, then if they accept Original Medicare, they're going to accept your plan. So that is very beneficial to have the flexibility to choose your doctors. The other major benefit to going this route is because, yes, you're going to pay more per month. However, if you choose a certain Medicare supplement plans, then you're going to have very little to low out-of-pocket costs when you do have major medical issues. The other nice thing about going with this route is that you can switch your drug plan once a year during the annual election period. And so while your coverage stays the same for the medical side of it, your prescription coverage can be personalized to your needs, and also you can purchase your dental, vision, and hearing coverage separately. So it's almost like you're customizing and building the plan to your needs and your budget. Now, the other route that I mentioned of how you can cover that 20% gap is to go with Part C, which is a Medicare Advantage plan. Medicare will no longer be responsible for paying your medical bills. It's going to be an insurance company that pays for your medical bills. These Advantage plans are very attractive because, number one, you have everything rolled into one. So instead of carrying around your Medicare card plus your supplement card and your drug card, it's just one card. And when you go to the doctor or you go to a pharmacy, you just hand them that card. So that's kind of nice. The other thing too is a lot of these Advantage plans are very low in cost. And so you're going to pay your Part B premium either way, but instead of having to pay additional for Medicare supplement and then also a drug plan, many of these plans are as low as $0 per month. So some of these plans are actually not going to cost you anything in addition. And even in some areas, some of these Advantage plans now are offering a Part B give back, meaning they're going to help pay for your Part B premiums. And so monthly, this is going to be the lower cost option. These Advantage plans will also cover additional things that Original Medicare won't cover. For example, basic dental, vision, hearing. A lot of these plans will actually cover meals while you're recovering from surgery. They will cover gym memberships. So a lot of added things and benefits that Original Medicare won't cover. However, there is a downside to these plans. So the biggest downside is that you will be at the mercy of your doctors accepting the plan. So if you choose an HMO, then you need to make sure that you stay in network and be sure that the doctors that you're seeing are in network. If you choose to go out of network, you may end up paying for the whole entire visit, except for in the instance of a true medical emergency. The other disadvantage to choosing a Medicare Advantage plan is that while you're healthy, you are going to save a ton of money on the monthly premiums. However, if your health starts to decline, then you're going to have a lot of doctor visits and you're going to have co-pays and co-insurance that will eventually nickel and dime you. Now, there is a max out of pocket for these plans. However, sometimes the max out of pocket is way more than what it would have been if you had paid for a supplement plan with $0 co-pays. And so with so many different factors into choosing the right plan, I highly recommend that you work with an independent broker such as myself or my team that can help you figure out what is the best route and what is most appropriate for your situation based on your needs and your budget and the options available to you. So please reach out to myself or my team at Medigap Pros at 800-850-9657. There's never a fee to using a broker, and you're going to pay the same price through using a broker as if you went direct with a carrier. But the main difference is a broker will be the one to go to bat for you if you have any claims issues. And also, as a service that we'll provide, we'll review your plan options each year because your needs may change and plan options may change as well. Thank you for taking the time to watch this video. If you found this video insightful or useful, please give it a like. And also, if you would like to be notified when we put out new videos regarding health insurance or Medicare, please subscribe to our YouTube channel. And we're happy to assist you with any of your health or Medicare needs.